Hello guys, welcome to my YouTube channel Legend of Pharmacy. Today let's discuss about the pathophysiology, very important questions for 2023 examination of your B Pharmacy second semester. Very important question these are, so you only practice these questions. These questions for your tomorrow's examination will help you a lot. Okay, what questions I am going to tell you, 10 mark question and 5 marks questions. These are really fantastic and magical questions. Practice only these questions only. Okay, you don't go beyond this. And also I will tell you how to write the pathophysiology. Okay, in one attempt only 100% you will pass. You know what to write, but you don't know how to write. You know that if anyone asks this one means we have to write this content, but that content is also very important, but how to write, that is also very important here. So you have to keep that in mind. Now let's discuss about the 10 marks. See, watch this video. First one is explain etiology, pathogenesis, morphology of the reversible cell injury. See, either they will ask reversible or irreversible. From these two, one is fixed. See, you have to define first. What you have to define, what is the cell injury. Then you go for classification, reversible, irreversible. Then you write what they ask. If they ask reversible, then you write reversible. Explain that reversible, causes you write, symptoms you write, and you explain. Then you write the mechanism of that reversible. That's morphology. Then you go for the pathogenesis, pathophysiology of the reversible cell injury. That is very important. First, to draw the chart. Reversible means the cell again it can comes to its normal position. Reverse. Okay. Here irreversible means it owned, means necrosis will attain. Necrosis, if necrosis attain means it is irreversible. Only this thing you have to understand. Reversible and irreversible both are same. But in irreversible, the cell attains to necrosis, cancer cell, destroyed completely. The cell cannot comes to its original place. It cannot regrow its biosynthetic properties. That is irreversible. Next question, define angina pectoris. See, here you have to write the types and pathogenesis of angina. See, any disease, you write first definition of that particular disease. Whatever they ask, if they ask irritable bowel syndrome, or they ask the hepatitis, or they ask typhoid, syphilis, HIV, liver problem, kidney problem, any disease, try to write first definition. Then you go for the classification, causes you write, symptoms you write, pathogenesis you write, risk factors. When you have to write, if they ask in 10 marks. In 5 marks, you have incompleted the 3 pages. Then you can write the risk factor. For all, maximum risk factors are same here. They can lead to diabetic, they can lead to neuropathic problem, okay, several other kidney infections. These basic you can write, or liver infection. Taking excessive tablet that leads to the liver or kidney infection. No, that you remember and write down. Then what are the metabolic disorders? Pathogenesis of the diabetes mellitus. Metabolic disorder means diabetes mellitus type 1, type 2. Classify that and write down. Pathogenesis of the Parkinson disease. Very important one. Same what I told, no definition, classification, that all you have to write here. What is atherosclerosis? Very important. Explain. Next, let's jump for the 5 mark question. Here also typhoid, they ask disease typhoid. Right, what is this typhoid? Disease causing. Typhoid is caused by the bacteria called Salmonella typhi. Etiology you write. Etiology and causes both are same. Okay, transmission, it is transmitted by, that also you have to write here. What is schizophrenia? Mention the positive and negative symptoms of schizophrenia. Then pathogenesis of the acute renal failure. Causative agent, mode of transmission, and symptoms, signs for the syphilis. Signs and symptoms for the syphilis. Write a note on hepatitis 1. Then explain pathogenesis, clinical presentation of the gout. Then pathogenesis of the leprosy. Healing by primary and secondary intention. Define, classify, and you have to explain this one. Primary, either they will ask healing, wound healing property also same, healing property also same. And then inflammatory bowel disease. Piles is also a type of inflammation, bowel disease. Inflammation in the intestine, inflammation in the rectal cavity. These all are comes for the inflammatory bowel disease. Then you go for the explain sequential stages in chemical carcinogenesis. Write the definition, write the stages, explain the stages and all. Then explain depression and mania. These both are psychological disorder, depression and mania. Write this. A role of chemical mediators in the process of, very important one, role of chemical mediators, Okay, what is inflammation, types of inflammation, what is the role of chemical mediators, what is the role of nitric oxide, what is the role of free radicals. This all you have to write down, okay, keep in mind. Then etiology and pathogenesis of the osteoporosis, same. Yes, these are the 13 5 marks question and 5 10 mark question. If you want 2 marks, means notes are already prepared. Okay, 10 5 2 on single branch of notes is there which covers these questions. You practice that notes, definitely you will get a 45 plus marks in the pathophysiology of your tomorrow's exam. And that notes is 1 day preparation. If you study the whole day today, definitely you will pass. So if you want the notes, means in the description there is my number, there you can WhatsApp, pay 29 and you can get. Clear? Thank you, and subscribe Let's Join Pharmacy, because don't forget to subscribe, because in upcoming session I am going to give a beautiful answer notes and also questions with answers, where for your upcoming exams, like now you are in second semester, for third semester a very good notes with important questions I am going to provide. Because of lack of time I can't, but now inshallah I will come to I will invest my time more, and I will upload the videos with answers in that booklet, means in that answer, and also I will try to explain that all. So subscribe. Thank you.